once again, this is Mr. Deshaun of the Parenting Network. I'm glad to have you with us. And what I'm going to do, once again, is cover our Making Proud Choices program. And today we're going to have a review of our STD lesson, as well as talk a little bit more about HIV. I hope you all had a chance to look at the STD video, as well as the HIV video. And what we'll have now is a little bit of a review of those videos. So when it comes to STDs and STIs, we do see that STDs stand for sexually transmitted diseases. STIs stand for sexually transmitted infections. Again, when we use these terms, we'll be using them interchangeably. So if you hear me say STD, STI, I'm talking about the same subject matter for this conversation. Who can acquire bacteria, virus, or parasite? Who can acquire bacteria, viruses, parasites? Yep, I think you guys got that right. I'm sure you all are, that males, whether you are a child, preteen, teen, adult, whether you are female, preteen, teen, or adult, even babies are susceptible to the virus or the bacteria or the parasite, often passed from mother to child. Again, anyone can acquire a bacteria, virus, parasite, doesn't matter birth, gender, sexual identity, gender identity, any of those, doesn't matter. A person, a human being, can acquire these STDs, bacteria, viruses, and parasites. So I also hope you all had a chance to look at this worksheet and work through it. We're going to do a quick review with this worksheet. I'll just have you fill in the names of the bacterias for the top row. So you can actually go ahead right now, if you have this paper with you, you can circle bacteria for all of them. The 1, 2, and 3 are bacteria. Number 4 is a parasite. So let me make sure we're clear on that. 1, 2, and 3 are bacteria. Number 4 will be a parasite. So for the bacterias, we have for number 1 would be chlamydia. 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 In the number 2 space, you have gonorrhea. 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 In the 3rd space, we have syphilis. 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 Number 4, which we have said is a parasite. Again, a parasite is trichomoniasis, but you can just fill it in as trick. TRICH. TRICH. Number 5, we have herpes. 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 Number 6, the number 6 space is Hep B, hepatitis B, but you can put Hep B, HEP, the letter B, HEP B, Hep B. Number 7, HPV, human papillomavirus. You can write down HPV. Again, that is HPV. And number 8, HIV. HIV. And if you want to draw an arrow and then write in AIDS, AIDS. And again, HIV may or can become AIDS in a person, but it does not necessarily have to or will. We want to be really clear on that. And when we go into a deeper review of HIV, we will make sure we cover that again. In our discussion, we want to make sure that we are also paying attention to some of the things that were on the STD, STI quiz, if you all were able to take a look at that. So let's remember, for number 1 on that quiz, it asks, is it possible to get more than one STD or STI at a time? The answer to that is yes. Number 2, list which kinds of can be cured with medication from a doctor. That would be those STDs or STIs that fall into the category of bacteria. So chlamydia, gonorrhea, syphilis, as well as our parasite can be cured with medication from a doctor. So that would be trichomoniasis. List which can be, this is number 3, list which can be controlled with medication from a doctor. Herpes, HPV, and HIV. Herpes, Hep B, HPV, HIV, AIDS. Number 4, if you are sexually active, how often should you get tested? All right, so this one is you should get tested according to the CDC every 3 to 6 months if you are sexually active. Right, you want to make sure you go get tested with a new partner every time, with a new partner before you engage in sex. Make sure that you are paying attention to your body. So if you have had sexual intercourse and there's something that you know or you see as a change in your body, you definitely want to go to find out if maybe there is an STD, especially if it is something in your reproductive area. So just paying attention to your body. Again, every 3 to 6 months, with every new sexual partner or new sexual experience. And if you've had sex and you've not been tested, you should go get tested just in case. Number 5, name a place in Milwaukee where you can get tested for free. One of those places would be Planned Parenthood. We can use that as our answer, Planned Parenthood. There's also 16th Street clinics. There are several locations. If you want to just look those up at some point, you can do that. Number 6 asks, is the test private or confidential? The answer to that is yes. The test is confidential. Under the laws that we have, someone cannot take your test results as far as a doctor or nurse and run out and tell someone your results. They are confidential. We want to make sure we're aware of that. Now, if you do get tested and you're using your parents' insurance, you do want to understand that it will be noted as a test run on their insurance. It would not give a result of the test, but it will show that a chlamydia test or a herpes test or HPV test was done, and it will show up on an insurance note of what tests were run and the description of the charges. So just be aware of that and mindful of that. But again, if you go to a Planned Parenthood, a 16th Street clinic, they may help you get your own insurance, and it also may be where it's done without the need for insurance, depending on what the tests are. Those are, again, confidential. What you want to make sure, though, is if they do tell you to call back at a certain time or by a certain time to find out your results, make sure you call back to find out your results. Otherwise, they may send a letter or make a call to the number or address you give them, and they'll say something, it will be simple, not disclosing your test results, but it will say that you were at their clinic and they would like you to contact them for further follow-up. Not saying positive or negative for the results, but they would need you to contact them for follow-up. So just make sure that you're aware of that. If you want your test to remain confidential, follow through. Go get your results, call for your results. That way you can make sure that your confidentiality is protected as far as your results being positive or negative. Number 7 on our STI, STD quiz, is it smart for teens to get tested? Yes, absolutely. I think we got to realize that STDs spread quickly. You don't know if your partner has anything and the other health risk involved. So yes, it is very smart and wise for a teen to get tested if they are sexually active. If you've never engaged in sexual intercourse or sexual activity, you're not at risk of STD because you have not put yourself at risk through those activities. So being mindful of that, Two people without an STD are not going to create an STD. So if you are involved with someone and there's an STD that is passed from one person to another, one of those two people had to have had that STD. Number 8, how do untreated STDs hurt the reproductive systems? There's a number of ways it can hurt the reproductive systems. They can cause damage to the fallopian tube, to the ovaries, to the testes, and can ultimately affect a baby's health. So being really aware of that, mindful of that, there are a number of areas that can be impacted. There's also prostate cancer that can be caused in men, ovarian cancer in women, cervical cancer as well. So we just want to be really mindful how we treat our bodies and how we look after our bodies. So even if we've engaged in certain behaviors, we still want to be responsible enough to take care of our bodies even after the fact. And what is the message? If you guys watch the video, what is the message or main message in the STD video? So a main message is that abstinence is the only way to stay safe and avoid STDs. So that again is choosing to not engage in sex or sexual activity for a period of time, whatever time period you choose. That is up to you. That is your personal choice. Again, some people may choose to marriage. Some people may choose till they're financially stable already, or until they finish college. Everyone has that choice. To abstain means to practice staying away from something, and in this case, sex and sexual activity. Also, a message of the video was if you do engage, you want to make sure that you're using protection, that you're protecting yourself, using a barrier method to reduce the risk of STDs. Do barrier methods protect from STDs entirely? Is it 100% effective? No. But that is just making sure that we understand that barrier methods are absolutely better than nothing at all. So making sure we're aware of that and we pay attention to it. And also, this is a question for you. I'll leave you with this on this part of the quiz. Who can you talk to when dealing with sexual pressures? All right, so think about people you can talk to. It could be relatives, it could be friends that are trustworthy, that are aware of this information and can give you honest and truthful answers. So that might be an adult, it might be a teacher, it might be a parent, guardian, it might be a family friend that you have a trusting relationship with. There are a number of people that you can talk to. Any of the clinics that we mentioned, they have staff and resources as well to help and assist you. There also is an organization known as Diverse and Resilience that does great work in the community, working with individuals who are LGBTQ+. So they're another great resource if you want to reach out to someone that has a wealth of knowledge and experience working with the LGBTQ+ community. So with that being said, we're now going to proceed with a little bit of microcosm Jeopardy. Excited, are you? I am too. So this is a tiny single-celled organism. Outnumber our human cells 10 to 1, can live on its own or in living things. You want to take a guess as to what this would be? It also can be both friendly and unfriendly. So there are considered to be good forms of this and bad forms of this. So would this be, what is a bacterium? What is a bacterium? Bacteria, right? So these are, again, tiny single-cell organisms. They outnumber human cells 10 to 1, can live on their own or in living things, and they can both be both friendly and unfriendly. Good or bad, bacteria do exist. So what is a bacterium? So that leaves us with, what is this? They're smaller than bacterium, a fragment of DNA in a protective coat, must live inside of things to survive, must live inside living things to survive, and injects its DNA into cells, taking over. I'm thinking you guys might have got that right. What is a virus? What is a virus? So a virus, again, is smaller than a bacteria. It's a fragment of DNA with a protective coat, must live inside living things to survive, and injects its DNA into cells, taking over those cells. That is a virus. All right. So what do we know about HIV/AIDS? Let's talk about this a bit. We're going to do just a little bit more extensive conversation about this. HIV can become AIDS in an individual who is infected. HIV is connected with AIDS. So again, if a person has HIV, that means they have that virus in their body. And if untreated, that virus can connect and become AIDS or part of that person's AIDS journey. If it gets to that point, there is no cure for HIV or AIDS. Antiretroviral treatment can slow progression of HIV. So this is where if someone does have HIV, this is where the treatment component of it comes in, where a person can take this medication. It slows down the virus from multiplying and attacking your immune system. So what HIV is doing, it enters your body and it attacks your attackers, which are your immune system. Your immune system is supposed to fight off infections, but if your immune system is under attack and it's being killed off by this virus, after a while, you won't have enough attackers to take care of even smaller bacteria and viruses that enter your body. And so when it gets to that point, a doctor will diagnose someone as having AIDS, that their body can no longer fight off infections that normally would be fought off pretty easily. And so people will end up often dying of AIDS-related complications when they are then diagnosed with AIDS. But a person can live with HIV and not get AIDS for a very, very, very long time, if ever. Someone with HIV could actually die of old age, and that's it, old age, and not have been diagnosed with AIDS. So again, it weakens the body's immune system, and more studies are increasing our knowledge about viruses and how to treat them. So being aware that there's more and more information coming out about HIV, more information coming out about AIDS. And as we know it with the science and things that are discovered, information may change over time. But right now, this is the knowledge that we have to work with. So this is how we protect ourselves, by getting the knowledge and using the knowledge to the best of our ability. How HIV becomes AIDS, we'll break that down a little more for you. So you have someone who may have a healthy immune system, right? Their immune system is healthy, it's fine. There's those T cells. The T cells are those immune cells that help fight off infection. So if there was a bacteria or virus that gets into the system, a healthy immune system, those T cells go to work and they're attacking that virus, and they're actually causing that virus to die off. So again, T cells, they protect the body from disease. So you're thinking now someone who has a compromised immune system, which means that now they have an immune system where the virus is replicating itself, it is multiplying, and it's also attacking the T cells. So a virus reproduces and they hijack your healthy cells. They take over those cells and they become no longer functional for your protection. So after a while, those T cells become fewer and fewer. So if you do not have enough T cells remaining in your body to fight off a cold or the flu as you normally would, where a cold you could fight off in 3 to 5 days, typically, you know, you'd be sick and you'd be ill, but you get better because your immune system is working. If your immune system is not working, that cold could last for weeks at a time. Or the flu might typically take someone a week or 2 weeks, depending on how severe it is. It might end up taking a lot longer for a person to get over that, and maybe not even get over that. So now you see the virus again has now begun to outnumber the T cells. And if that happens, then now you have a person whose body is extremely compromised by the virus. And so we want to be mindful of that as we process what happens to our bodies. How to reduce the risk of getting HIV/AIDS? Be abstinent. Make the choice not to engage in sex or sexual behavior for whatever time seems to be beneficial to you. This is something that you may talk to your parents about. You may look at your life and figure out what goals you want to accomplish and what might be best for you as far as waiting to engage in sex and sexual behavior. Never injecting drugs or sharing needles. So we do know that HIV can be transmitted through the use of needles, drug needles, being injected from one person to another, because even when you pull a needle out from one person's arm or wherever the injection is happening, there are traces of blood that can be injected into someone else if they use that same needle. Also, we want to make sure we are clear when we talk about sharing needles. That can also be for tattooing and piercing. We want to make sure that you guys are as safe as possible. So if you ever go and get tattooed or pierced, make sure you're doing it by someone who is professionally licensed to do it, who has the hygienic cleaning equipment they need to clean their tools, and they use a new needle every single time. Someone who is licensed has something to lose, so it's more likely they're going to follow rules and regulations. And they also should not be scared of you asking them, please show me the needle as you're opening it up, right? That you're using a clean needle. I want to see for myself. And they should be perfectly fine with that. So again, I really push for you all to make sure you're taking care of yourself. So if someone is saying, hey, I want to do a tattoo party or I want to do a piercing party, and they're not using a licensed professional, you should not be at that party getting tattooed or pierced. Just make sure we're using professionals and people who are going to take care of us. And we got to make sure we're taking care of each other by asking the tough questions. Like, is there a licensed person? Does that person will they let me see their license? Will they let me see a new needle? Because we just want to make sure that we're the safest we can be. So sharing needles, even for tattoos or piercings, can transmit the virus. So let's be safe. Use a latex condom each and every time you have sex. Using a latex condom each and every time you have sex greatly reduces the risk of HIV being transmitted from one person to another. Is it an absolute fail-safe? Like there's no way you could get HIV? No, there's not an absolute fail-safe. Like, no, it's still possible, but very, 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 very less likely than if you're not using anything at all. So you want to use a latex condom every time. If you are allergic to latex, there is polyurethane condoms that you can get, or polyisoprene condoms as well. So make sure that you are protecting yourself. So even if someone says they have a latex allergy, there are alternatives. There are alternatives. So make sure you're paying attention to that. Do not use animal skin condoms. Animal skin condoms do exist. They're more of a novelty thing, but they do not protect against HIV. They do not protect against HIV. You also want to use a water-based lubricant. So if you're looking for lubricants, you want to make sure they're water-based, not oil-based. Anything oil-based will interact with the condom, the latex of the condom, and it will cause that to break down, and the condom may actually break quicker than if the condom was just used by itself. So you want to make sure that you're not using anything that's going to decrease your chances of protection. So using water-based condom or lubricants only with your condoms. Have a trusted partner. Monogamy can keep you safe. So if you choose to be with just one partner, that does reduce the risk or the chances of the virus being spread from one person to another. Also, just making sure that that conversation is happening with a partner, that you're talking about getting tested and trusting each other, and even deciding maybe we'll get tested every so often until a certain point, right? We decide what works for us, and that's what relationships really should be about, and sexual partnerships. And discuss HIV with your partner. Have that discussion, have that talk, because it is really, really important that we speak with one another and share with one another our thoughts, our feelings on the matter, and we get tested for HIV. Get tested, right? If you have had sexual intercourse, sexual contact, if you have even shared needles of any kind with someone else, just go get tested. Knowing your results go a long way to helping protect and save your life in the long run. So even if you are diagnosed with HIV, you have medications that can help you live a long, healthy life. And it does not have to be the stigma it once was, that a person who has HIV is going to automatically die. No, not at all. Avoid having multiple or overlapping partners. This is a big one. Avoid having multiple partners or overlapping partners where you can't really get the time frame of when you may have come in contact with the virus, if you were to come in contact with the virus. So making sure that you're getting tested frequently and in between partners, and hopefully with your new partner, you will get tested. And stay away from substances that will cloud your judgment. So drugs and alcohol. If you are using these substances, they may cloud your judgment. You may not think as clearly as you would otherwise. And that can lead you to making some decisions that could cause complications for your life and your future. Learn about PEP and PrEP medications if you are exposed to the virus. So understanding PEP and PrEP, that you can take one beforehand, and it will help reduce the chance of the virus entering your body and being able to survive there. And as well as PrEP, if you are taking if you have been exposed to HIV, PrEP and PEP are both medications that can work to help you not pass the virus on to someone else. So being really mindful and aware of those medications, talk to your doctor, ask about their effectiveness, and if it's something you should think about taking, even if you're not, if you don't have HIV. It's something that you use to prevent. And if you are HIV positive, there's one you can take to help reduce the spread to someone else. Use the power you have to make healthy choices. That's it. Simple, right? Use your power. Use your ability to think things through, process, talk to other people to help you make decisions. The power is yours. You can make these healthy choices. So with that, I want to thank you all for once again being here and listening, being a part of this discussion. Again, your safety is not only my concern, but I do hope it is your concern. And when you understand STDs and HIV, and how all STDs work, you can be empowered to protect yourself and your well-being, and also look out for those around you and your sexual partners. With that, I thank you for your time, and I will talk to you all later.